Do you prefer talking to your family doctor in your first language? Well, for decades, two family physicians made that possible for English-speaking patients here in Quebec City. But Dr. Alec Cooper and Dr. Delafield are both retiring just months apart. It's leaving several hundred Quebec patients who speak English with a lot of questions. One of them is Gilles Gagnon. She was Dr. Cooper's patient, but now she says she's out of options.
I've considered going into the private sector. I think that my mental block there is that I'm paying taxes for a healthcare system that isn't serving me. So am I going to pay additional money for a private option? I don't have a lot of expectations of finding a doctor. In fact, I think it's probably a little bit easier to get Taylor Swift tickets than find a doctor in Quebec.
She might be right. The head of one organization that helps Anglos get health services says as far as he knows, Dr. Cooper and Dr. Delafield were among the last Anglo family doctors still practicing.
In the case of a couple of weeks and months, we now have quite a few people out there who are now orphans, as we call them. I know from talking to a few of people who I know were patients of these doctors, they are worried and they are stressed about the fact of how long it will take them to find a family doctor and what to do in the meantime.
Walling says the first thing people should do is register with the waitlist managed by the Quebec government to find a new family doctor. Once they've done that, they can book an appointment through what's called the Primary Access Care Program by booking online or calling 811. But he says there's no way of knowing for sure if they'll speak English. Meanwhile, Dr. Cooper says if he could keep working, he would. He had 1,800 patients, but last November, he was diagnosed with ALS. It's something that forced him to take a snap retirement.
The original plan, and I think it's a normal plan for most family doctors, is to work beyond the normal retirement that most people take, because we don't have a pension for one. We save up our money for retirement. As long as a doctor is fit, they can continue to practice even into the 80s, That was my plan, and when this diagnosis came up, that sort of changed a lot of things. I was terribly torn. I have very close relationships with a lot of patients.